We are delighted to have you join us as part of or a sideline to the conference you having in Accra. Let me start with you, Mr. Farid Fezoua of Fezoua. What would you say is your assessment of the various healthcare systems on the continent?
Well, first of all, thanks for having us, and it's always good to be back in Accra and in Ghana. And back to your question, I would say that the development of healthcare in Africa has witnessed huge progress, particularly over the last 7 years, I would say. And it comes through a few key factors. First, the realization that the commitment to the Sustainable Development Goals, as well as the attainment of universal health coverage, has become a true priority in the minds of the governments. And across the continent, I would say that today African governments do put the emphasis in their discussion as priority for their mandates. If I highlight some of the key priorities for governments or presidents, whether it's Kenya, whether it's South Africa, whether it's Ghana, your president is actively involved in the attainment of universal health coverage himself. Second, Africa is standing out as probably the continent in the world that spends the least till today relatively to the global spend in health, at a tune of about 1% of the global health spend. However, we've seen in many countries that a percentage of the budget being granted to health increasing. So that's a second factor which is helping. The last but not least is really the realization that there needs to be different models of the way we deal with healthcare infrastructure and the way we deliver quality and affordable health in the countries, together with more opening in terms of partnership with the private sector. I remember a time, and it was not that long ago, where it was almost taboo to consider that the private sector could play a role in health in many countries in Africa. Today, we see open doors. We see governments asking for the private sector to play a bigger role, a more impactful role, under what I call the shared value equation, where you can work with the government as a private sector player to deliver social impact, long-term sustainable social impact, but at the same time generating economic value for your company or your shareholders. And I think that's the balance that we're starting to see developing. We've seen some examples of that. Here in Ghana, we've been very active in implementing these new delivering models in the primary care level with our deployment of handheld ultrasound and capability building of midwives and nurses across the CHIP compounds in Ghana for the last 5 years. That is addressing directly preventable or the burden of maternal and infant mortality, which we know the incidence is still relatively high. Similarly, we've done in other places of the continent, and in Kenya, for instance, the modernization and revitalization of existing district hospitals. That sometimes it's not about building new hospitals necessarily. It's revitalizing, making existing facilities more efficient. It's a combination of technology, infrastructure, and training and skills development, as well as service and maintenance of this infrastructure and technology, because we've seen in the past that technology not serviced and maintained properly does not allow to deliver on the outcome.
So how adaptive has the African countries been to improving healthcare with reference to probably technology and building on the capacity of its workforce?
So some of the countries have now shifted gears in terms of, typically if you look at 20 years ago or even 10 years ago, the typical way of procuring was for existing facilities was to buy equipment into tenders or bids and getting as a criteria maybe the cheapest technology or not necessarily the most adapted technology. And then there was almost consistently very low level of provision for service and maintenance of that technology, and almost no provision for training the users of this technology. So for me, these two pillars of what I call the pillars of sustainability were missing. And I think we've seen the shift gradually because we knew that the old model was not delivering the service to the patient in the long run at an affordable cost of delivering service. So we're quite optimistic, and it's only the beginning of the journey to change the game. 2030 and the attainment of universal health coverage is for us a true goal.
Let me let you hold your breath on that, and let me come to Mr. Ebai. What are some of the key projects that General Electric, for instance, has implemented in Ghana, and what has been their impact on healthcare?
Thank you for the question. Yeah. We've deployed almost 500 V-scans in 125 districts across Ghana. We've trained over 600 midwives how to use the equipment and to interpret the data. And the goal ultimately between the launching of the program to 2020 is that more than 1.5 million scans will be done with those equipment, targeting early detection of complications during pregnancy, which would instantly directly relate to lives being saved. And as Farid mentioned, we didn't just deploy the V-scans. It comes with a training program, so it's task shifting from doctors to midwives and nursing staff within the rural communities of Ghana. It's enabling interpretation of the data so that you can identify complications and refer to the secondary level of healthcare provision across Ghana. Aligned to that, there was a robust service package that was put in place as well. So we have a robust service of those V-scans over a 3-year period, which will be extended to 5 years, I believe. Where if anything goes wrong with those equipment, it's fixed or replaced. Okay, so the package is not just equipment. It's education, it's training, it's task shifting. And it's aligned completely with the universal healthcare goals, which is standardization of treatment and care across the entire nation. At the other end of the spectrum is RIDGE, the regional hospital here in Accra, where GE worked alongside the Ministry of Health, Ghana Health Service, funded through US EXIM money with a French contractor, where we've been the key provider of advanced medical equipment in this 600-bed hospital, which is servicing the public community of Accra. And there you've got a state-of-the-art diagnostic center. You've got our life care solutions portfolio in the theaters, in the ICU, in the intensive care unit. It's one of the very few neonatal intensive care units that's in the West African region, and GE played a very key role in structuring that transaction alongside the partners to deliver on that project. And then now, 2 years after the opening of RIDGE, it's the GE service organization that is maintaining and ensuring the equipment is working and the uptime is kept up. We keep the uptime up as much as possible.
So since much of the talk is focusing on universal health care, which is basically at the primary level, I just want to find out from you, what has been your views of our chip compound structuring? What do you think is gone amiss?
From a universal health care cover, it actually covers primary, secondary and tertiary care. Okay, so what you're trying to do is ensure that there's coverage for the population at each level in the healthcare pyramid. So can someone be diagnosed at primary health care level, referred to secondary care, and then referred to specialty care if need be, and covered with some form of national health insurance scheme.
Let me come back to you, Mr. Fezoua. You have been through the length and breadth of Africa, I believe, and you probably know of the best practices and how it has worked. If you can share with us some of these innovative solutions and how it can be scaled up to other parts of Africa.
What we did in the cheap compounds in Ghana at primary care level, at scale, because for the first time, truly, there was a program that combined a technology, which is the handheld ultrasound, going into the community, the cheap compounds, training midwives and nurses, and ensuring the viability over time of this program, so that it's not a program for 6 months or 1 year. It continues over time to deliver the impact. How do you look at all these existing primary health centers above the cheap compounds that can be revitalized, where you can kind of modernize the infrastructure, not at a cost that is, completely out of proportion, because that will just kill the purpose if you did that. No, at what's required, putting the right technology, so you would move from a handheld ultrasound to including safe surgery type of issues. Cancer today is a big issue. We just finalized, the setup of a fully integrated cancer treatment center, from advanced diagnostic with PET CT scans for the first time in sub-Saharan Africa, excluding South Africa and Kenya. But Ghana could be truly the first country in West Africa to develop that solution, because you have the specialization to do that. You have the tertiary hospital, I would say, tradition to do that. And this is something that is needed, because treating cancer in the way it's treated elsewhere in the world is not a luxury. It needs to happen in Africa. So that's what we strive for.
Apart from building the capacities and the capabilities of the health workforce, much of what you do is also about technology.
Right.
Yeah, so I just want to find out from you if you've probably ventured into telemedicine, especially with the landscape of Africa, for instance.
Yes.
Much of what affects healthcare is access. Wider distances to access healthcare, poor roads, and even visibility and all that.
Well, you've summarized it so well, because the other aspiration that I did not mention is truly to break the barriers of access, distance, and cost. And the way we do that is leveraging digital solution and IT. And we're able today, even on the V-scan, we're able to take images in the cheap compounds from a pregnancy and send these images through 3G to Korle-Bu, for instance. And if we have a gynecologist in Korle-Bu, then the gynecologist can say, looking at this image, do a diagnostic and a reporting. So we're already doing telemedicine, or we could do it.
Yes.
Technically, there is no issue to do it. We've done that in some of the countries in Africa, where we've connected hospitals that are linked to a center where reporting in radiology particularly, but it could be done in different type of specialization. Cancer or oncology could be one. So we could imagine tomorrow having a fully integrated cancer center, and that's the way we would like to contribute to do it. And then being able not only to have the surgeons here in Accra or the specialist in Accra, but being able to have virtual, what we call tumor boards, where these specialists here in Ghana could consult with other specialists in the US, in Europe, in Japan, and get a second opinion or third opinion, and get to the best way of treating a cancer, more specialized. And this is our aspiration around precision health as a company, we stand as a vision to enable precision health, with it really doing, the right thing at the right moment, and more customizing to how we look at addressing a disease burden. It also means for governments to enable them to do precision public health. And in Africa, this is a big thing, because being able to map out your country and say, I have incidence of maternal and infant mortality here, I have incidence of, cervical cancer there. How do I map out my capabilities?
So speaking about government collaboration, Mr. Ebai, if you could tell us what kind of collaboration, because we would obviously want it scaled up. 500 or 600 personnel and 500 tools may be significant, but it's still small for the entire country. If you could tell us what you're doing to scale up.
Sure. So, I mean, we're working very closely with the Ghana Health Service and the Ministry of Health in defining and developing the next phase. So there's discussions around the next phase of the VScan program, which would take your handheld ultrasound, which is prenatal, and then looking at postnatal. So looking at, so if you have complications and you have a baby, do you have the appropriate technology that's adapted to the rural environment to be able to care for that child, to ensure that that child survives after maybe a traumatic birth. So we're having, very good detailed discussions with the government in how we scale up and move to phase 2 of that program. The other area we're working on is, which we discussed a few minutes ago, is around that district hospital space. So that referral point. So what is that first referral point from a V-scan to the next stage when there's complications? So again, we're having, some very good discussions with the Ministry of Health, Finance, etc., Ghana Health Service, to see how we can also deploy again a program that makes sense in regards to the ultimate goal of universal healthcare coverage that's affordable and that can deliver the goals and the objectives of the Ministry of Health.
Okay, so what would be your priority areas? I mean, this time around it was the primary healthcare levels and also in a few districts. What would be your priority areas for that?
No, I mean, look, we did 125 districts out of 215. So I think that, my maths aren't brilliant, but I think it's not a bad percentage, right?
Yeah.
But your point is, yes, you want to cover the full 215 and then scale up into that next stage of the VScan program. But our priorities are clear. It's the entire healthcare pyramid. Okay, so it's primary healthcare, it's district hospital, it's tertiary specialist hospitals, it's mono-specialist hospitals like oncology or cardiology. So I think the beauty of GE Healthcare is that we have such a wide portfolio of technologies and capabilities, and because of the infrastructure that we've built up across the African continent and in Ghana, we're able to deploy at scale.
When you're traveling along the road, you don't see much of these emergency response centers. Is there any plans of from GE, for instance, to establish such centers?
Clearly, I mean, if you look across the African continent and in particular West Africa, that's definitely somewhere where I know there's a gap in ambulance care, paramedic care. And in the discussions, and I know Farid, when Farid's at the World Health Assembly and other forums, it's something that I know comes up. So.
We actually, you're spot on, because we're actually currently discussing with another African country of creating those highway hospitals, because the road accidents kill a lot of people in Africa every day, and having these highway kind of emergency type of center, and what would be the configuration of both the technology, the training, same kind of recipe, technology, training, service and maintenance, to make those emergency type of response infrastructure efficient. So we're working on that, and I'm sure that we're going to do that someday in Ghana, for sure.
I'm going to wrap up with you. Just tell us what all these is leading to, with reference to your vision for Africa.
So, I think that the reason we're focusing on first developing the best technology, but the best technology that means and is relevant economically and clinically for the African continent. And we've already developed technology that have been designed and thought of from Africa for Africa. And it's already happened. We have examples. The V-Scan Access is a good application of what we have. We have anesthesia equipment like the Care Station 30 that was actually thought about with the contribution of anesthesiologists in Africa, and we deliver that product in the continent. So it's continuing to do that, really making sure that we invest in developing technology that are relevant for what we aim at doing at all level of care in the continuum, not only primary but all the way to tertiary. Second is that commitment really to skills development and capability building. We are a company that traditionally has taken a lot of pride training, developing skills for its own employees and also for the ecosystem in the sectors we're active on. So be very focused on that. Last is really execution. You know, I like to think that GE stands for General Electric, but it also stands for good execution.
Exactly.
That is one thing that we do well in GE, that when we take a commitment to deliver something, we do it. And we do it in a way and within the timeline we've committed to. And what we strive to do is make sure that more and more governments choose us as their partner of choice and trusted partner to be able to deliver for the long term. And we will be accountable for it. We'll measure what we do with the government. We'll look for others to measure what we do and being fully accountable for what we deliver in terms of outcome.
Okay, upon second thought, I thought I would be unfair to you if I didn't also make you have your last word. But, but what would you say to the cost effectiveness of these solutions that you've introduced, and as you wrap up on your thoughts?
Yeah, sure. Look, I mean, I think, you know, Farid's mentioned, you know, that it's adaptive technologies to the environment. And when we say adaptive, we mean it from a technology perspective, but also from a financial perspective too. Okay, so we're trying to, and we're continuing to look at this to get to a point where the equipment is affordable for the public sector to deliver universal healthcare coverage. That's what we're doing, and that's what we're going to continue to do. And we'll move to more advanced technologies to see how we can also adapt those to the, you know, the local context to ensure that they're affordable. You know, so I know there's a lot of money that's been spent in R&D, in research and development of equipment to adapt it to the environment that keeps the, you know, the gold standard GE, but is adaptable to the environment that we have. You know, be it power, be it humidity, but also energy to run them, and affordable to the public sector and to the private sector. So I think that, you know, that's something that we're investing in every day, and every year we have new products that come out into the market that we're able to deploy within the countries that we serve.
Okay. Thank you so much, gentlemen.
Thank
you.
We've
been talking to Farid Fezoua and Eyong Ebai, all of General Electric. Farid Fezoua is has oversight responsibilities over Africa. Let me just put it simply. And Mr. Ebai has oversight responsibilities over West Africa and by extension Ghana as well. And we've been talking about solutions, innovative solutions as to how we could improve our healthcare systems, especially universal access to healthcare. These have been our government's priority, and much of the dialogue about improving our healthcare systems have been driven by General Electric, and today we've had some few words from the managers of both West Africa and Africa. Yes, so how did I perform?
Very well, actually.
Very good, thank you.
You know, very...